Welcome to a program that we tagged Unshakable, Physical and Social Isolation on Mental Health. My name is Nsakisi Onibayo, and I'm going to take you through some of the aspects that we are dealing with during this physical and social isolation on mental health. I am trained, my background is pharmacy. I'm trained as a pharmacist. I spend most of my time in management roles. So I've spent most of my time, either as a lecturer, a head of department, or as a manager in a hospital. So I got some background, in mental health issues, although I'm not a therapist. And that's why I will make a disclaimer about this presentation I'm going to make. However, in Canada, I am trained as a mental health first aider. I'm trained in introduction to motivational interviewing, and I'm also trained in opioid crisis. I've also worked with people who are dealing with cannabis issues, whether it's recreational use or whether it is for their health. And in Ottawa, I worked, I volunteered in a community and responsible for the youth and the young adults. So my career at this stage is actually gravitating towards mental health. And the other thing I mentioned was the opioid crisis, which is ravaging North America as we speak today. So, as somebody who has been trained in drugs, it's something that I deal with from time to time. I spend half of my day actually speaking to a lot of people all over the world about mental health issues. So a disclaimer would be just to say the views of this presentation represent only my views. For further clarity on mental health issues, please use references provided, mental health website, or contact mental health office in your country or area. So I'm going to talk about three wings. I'll talk on mental health assessment, support, and introduction to motivational interviewing. I'll take you through the intro, the discussion, the conclusion, the reference, and then Q&A. Introduction. Life presents us with unanticipated twists and turns that can leave us confused, hurt, and frequently disoriented. If you or someone you know are experiencing depression, apathy, anger, conflict, stress, or other issues as a result of physical and social isolation due to the lockdown, help is available. Help is available. So don't wait to find the perfect moment. Start the conversation. Ask twice or more. Talk to yourself or about yourself. Approach the elephant in a room. It doesn't have to be face to face, and don't let the conversation stop. So these are some of the tools that you can use to start the conversation. And as I always say when I make presentation like this, the idea is not to get through the slides. The idea is to try and start the conversation and see how far we can go. So these effects of physical and social isolation on mental health affect two groups of people differently. People with underlying mental health problems, people without underlying mental health problems, or who have never been diagnosed or treated for mental health problems. So the fact that you have never been treated or diagnosed, of mental health doesn't mean that you're not suffering from some form of mental health. As we anticipate full reopening of businesses and a new dawn, let's always remember that the effects of the lockdown can leave permanent scars. We need to explore strategies to forge ahead without injuries. So I will do these three questions because these are important to actually open up a conversation. So the first question says, which of the following statement best describes how you feel as a result of physical and social isolation due to lockdown caused by COVID-19 pandemic? Under the heading fear. I fear change. I fear being alone, fear of being apart from loved ones due to isolation or physical distancing, helplessness, boredom, loneliness, and depression due to physical and social isolation. The next set of questions speak on stress. It says, which of the following statement best describe how you feel as a result of the physical and social isolation due to lockdown caused by COVID-19 pandemic? Number one, I feel no longer in control of things. Number two, I feel sad, stressed, confused, scared, or worried. Number three, I do not like to be alone. Number four, I'm concerned about my children's education and well-being. Question number three speaks on worry and anxiety. Which of the following statements best describe how you feel as a result of physical and social isolation due to lockdown caused by COVID-19 pandemic? I feel socially excluded. I'm anxious about getting sick with COVID-19 and of making others sick. I am worried about losing my job or already lost a job. I am worried about my financial stability. So I thought this picture depicts, the kind of message that we're trying to put across, and I just want you to press on a chat box, as you've been doing. Thank you very much for the answers to the previous three questions. Just put it on a chat box, select at least 3 words that best describe this picture, uh, 3 words that actually stands out for you when you look at this picture. So I said we have tagged our program Unshakable, and this is a position that many of us want to maintain in time of crisis, So I will take you through mental health quickly. And firstly, I'll define health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of diseases and infirmity. The Public Health Agency of Canada defined mental health as the capacity of each of us to feel, think, and act in ways that enhance our ability to, number one, enjoy life, deal with challenges we face, positive sense of emotional and spiritual well-being that respects culture, equity, social justice, interconnection, and personal dignity. It incorporates spiritual dimension along with physical, mental, and social aspects of our well-being. Mental health influences how we think, how we feel about ourselves and others, how we interpret events, example, lockdown due to COVID-19. It affects our capacity to learn and communicate. It affects our capacity to sustain and end relationships, how we deal with change or major stresses in our lives. Good mental health is important. It buffers us from stresses and hardships that are part of life for us all and can reduce the risk of developing mental health problems or disorders. This slide actually describes the three sets of questions that I actually asked. These are some of the negative effects of the lockdown, due to COVID-19 crisis. This slide speaks to physical and social isolation. Physical isolation is the circumstance of being alone and physically cut from people. And social isolation describes the absence or near absence of social contact between an individual and the system. Can be triggered by factors such as loss of mobility, employment, and health issues. Isolation can involve staying at home for a lengthy period of time, having no access to services or community involvement, and little or no communication with friends, family, and acquaintances. Can be a state of being cut from social networks. Social isolation or lack of social opportunity give rise to a sense of loneliness. People can be alone without feeling lonely. So many people experienced a lot of setbacks in terms of this crisis. Some were expecting to get help from other places, and they couldn't get that help. Some people lost their job, so they are actually physically and socially cut off. So those people are the ones that actually experience this COVID-19 on a larger scale. Some of the aspects, it's other social aspects would be like people who find themselves in serious problems with their families. Like, for instance, maybe they are undergoing a divorce, or maybe they are undergoing other stresses, or maybe the marriage is not okay, or maybe are going problem, they have a problem with a child, and having to find themselves in this kind of situation, created a problem. For me, the biggest challenge was I have children in Ukraine, I have children in South Africa, I have other children in Nigeria, and I'm here. And when I talk about children, I speak about biological and spiritual children that I have to be in contact with. So having being restricted to travel for me was a big issue, but we found ways of interacting with families, doing Bible studies, going via Zoom, and do all those activities, So there are many things that you can do to not feel alone. We also live stream things like movies, together, watch movies together, or have virtual dinners together. And all those things have helped us in, dealing with this problem. Physical and social isolation is not necessarily bad. Prolonged isolation is the one that is problematic. Different personality types react differently to physical and social isolation. There are examples in the Bible of social isolation which were profitable. Jesus Christ will go to the mountain to pray in a solitary place that, that was his time out, from all the things that were going on. And other prophets and other believers always do that, but there are situations which are problematic, like a siege. A siege is not a good thing because it's a kind of social isolation and a physical isolation that, create a lot of problems for people. For instance, the Bible tells us in 2 Kings chapter 6, 24 to 33, that Samaria was besieged and there was famine in Samaria. The head of donkey was sold for so much, and people were eating dung, and some were boiling their children, So that kind of challenge is the one that, makes this social isolation to be more problematic. And I put this question really just to trigger us into thinking about mental health as a serious problem. The pain of watching a family member with terminal cancer is the same as somebody battling with a major depressive disorder. And I put it like this because people think that, cancer is might be more painful because it's physical, and perhaps major depressive disorders are not, as painful. And I won't be able to go into details to explain this part of my slide because it's part of the topic that we will do next time when we do this program, because one of the problems that we have in this physical and social isolation is people with pre-existing mental health problems. So how common are mental health problems? Are they very common? They are not common? Not sure. You can click on your chat box and just put your answer there. How disabling are mental health problems? Are they very disabling? Not disabling? Not sure. And the other thing is the impact of mental health problems on the person's family and society. And really, this slide is just to take you through the fact that there are bigger challenges in mental health that we will not even be able to interrogate everything and finish everything today. Mental health problems are common. Professional help is not always at hand. One of the speakers today actually mentioned the fact that, you have to be referred to some of the professionals, in Canada for you to be able to access help. It might not be so in other countries. Like in South Africa, you might be able to access the services of a psychologist or a social worker or a public prosecutor or whoever you're wanting to access help from without having to have a referral letter. It is only when you're looking for a psychiatrist, which these are like trained doctors, they are trained deeper into the into the problems, and they can use drugs, to treat certain conditions. So it's when you approach a psychiatrist that you might be you might need a doctor's letter for you to access them. But for others, I know in many countries, you are able to access them easily. But in Canada, as it said, when you're accessing a psychologist, you also have to be referred. Members of the general public often do not know how to respond. There is a stigma associated with mental health problems. Not everyone with mental health problems seek treatment. People may lack insight to realize that they need help or that help is available. Many people are not well informed. Mental health was once listed as number one burden of diseases based on disability adjusted life. So, this is very, very important for you to know that it's something that we have to deal with. And why emphasis on mental health? I believe mental health should be given the same level of attention as physical health. It is important to understand mental health and to know how to talk about it. There are a lot of myths and outdated stereotypes. It is a complex topic and it's unique to everyone. Someone you know might be affected. Being able to understand and help people so that they have somewhere to turn to or having someone to talk to is important to me. If everyone or if anyone wants to talk about mental health but struggling to start the conversation, I would say it is hard, but do it. Talk to someone you trust. Let them know what you're going through. Just make a start, it gets easier. If you think someone is struggling, ask them if they are okay. Take them to a coffee or let them know you care and you want to help. The important thing is to try. You have to keep on trying, and as I said, keep the conversation going. I have a set of, another set of questions that I want to ask you. And on the chat box, please, select the ones that, best describe you. Choose one statement that describe your ability to assist someone with mental health problems due to physical and social isolation. And I just use physical and social isolation really because it's our topic today. But generally speaking, we're wanting people to be able to, recognize the symptoms. So number one says, I'm able to recognize the symptoms of mental health. Number two, I'm able to provide initial help. Number three, I'm able to guide the person towards appropriate or professional help. Number four, I need training to be able to do one, two, three. And many people think that they are able to recognize the symptoms, but I know of people who commit suicide and people have not seen that they were deep into a problem. So we need to be trained. I'm also a student of mental health. The reason I took all these courses, I told you that I took a course in mental health, first aid, and I took a course in motivational interviewing, and also took a course in opioid crisis. Is for me to be able to open up conversation and be able to talk about these issues without, pushing my way. And you will see in my slides. I thought I would talk about mental health first aid quickly before I actually move to the next subject. Like normal first aid, anyone can be trained. You may be able to save life or you may be able to save yourself. So mental health first aid was developed by the Mental Health Commission of Canada. It aims for early intervention. And, I'm talking of Canada because I am in Canada, but, all OECD countries, countries like Europe, and they use the same system that we have and they incorporate it into their to become part of their mental health strategies. So it's something that is gradually gaining momentum in all parts of the world because you need that early intervention. I mean, we have physical first aid. Why not have mental health first aid? And I'm also trained for opioid crisis, and the time that it's related to drugs, I'll be able to input into that thing. We aim for early intervention. 1 in 5 persons in Canada is living with a mental illness, and maybe it can be aggravated by the fact that there was a lockdown or there is still a lockdown. you know it aimed at someone developing mental health problems or experiencing mental health crisis. As mental health first aiders, we are not trained to diagnose or become therapists. We are there to listen non-judgmentally and let people know what help is there if they want it. Having an open and a safe environment for people to talk can make a real difference. Other programs include like things like suicide prevention, introduction to motivational interviewing, and dealing with substance abuse. So mental health first aid uses 5 basic actions of ALGI framework. ALGI is the framework for having a confident conversation about mental health with families, friends, colleagues, and strangers. Number one, you assess the risk of suicide and or harm. You listen non-judgmentally. And I can't emphasize the concept of listening. I just keep on, wanting to emphasize that when you listen non-judgmentally, you break the barriers or the walls, and you remove your paradigms. All of us have a paradigm where I'm coming from. You remove all those paradigms and you go into that person's space. You have to give reassurance, you have to encourage professional support, you have to encourage other forms of support. Mental health first aid is aimed at preserving life where the person may be in a danger to themselves or others. Provide help to prevent the mental health problems from becoming serious. Number 3, promote recovery of good mental health. And then number 4, provide comfort to a person experiencing mental health problems. So another thing that we need to do is to make sure that we inform people, that help is available in the form of being trained to know how to recognize this thing. And number two tool that I will talk about, the second tool, it's actually motivational interviewing, which is used as another tool. It can be likened to dancing, more than wrestling. Because in motivational interviewing, there are a lot of things that are different from when you interview a person from other perspective. So you plan it, you evoke, you focus, and you engage. So motivational interviewing is a client-centered method. It helps people explore and resolve their ambivalence to change. It empowers patients to make actionable behavioral changes in their life through an interview style discussion with a licensed mental health first aider. Note that these techniques are used by therapists also. Motivational interview spirit include partnership, acceptance, compassion, and evocation. And I have another question that I would want you to look into, although you won't be able to answer it today. But there is something that we call the readiness ruler. Readiness in, you wanting to make a change, and you need to define a lot of things. So it says, using the readiness ruler, decide on areas of change and rate yourself according to the statements listed below. It can be post-COVID-19 pandemic change or any change that you've been thinking about. Do the same exercise with members of your immediate family. So are you thinking about change? What changes are you considering? How important is it that you make this change? How confident are you that you are able to make this change? And how ready are you to make this change? So the readiness ruler really describe to you how far you are. For instance, if you are at 0, you're not ready. Maybe you're not considering any change. And when you are at 5, you actually not even decided. But when you gravitate towards 10, it shows that you are now decided on what you want to do. Another thing that you can use really is this step. These steps are very important. You can use them every day, every week or every month, to try and move from one point to the next. Which step have you reached today? Number 1, it's I won't do it. Number 2, I can't do it. Number 3, I want to do it. And then 4, how do I do it? And then I will try to do it. I can do it. I will do it. Yes, I did it. I just thought I would just ask this question because it was so, when I think about this question every time, it's something that I ask so many people, and it helps us to start that conversation. I get excited when people tell me what to do with my life. True, false, or neutral. you know. I said don't because, I've put a cartoon here. It just says stop overeating, stop drinking, stop staying out late, stop fighting, stop worrying, stop eating sweet, stop gambling, And later on, they're asked, what did the doctor say? Say, I don't know. I stopped listening. So in mental health, we don't want the conversation to stop. We want the conversation to be going on so that we can explore strategies of how to deal with it. There's a rule in motivational interviewing. You have to resist, telling family members, colleagues, or friends what to do and understand their motivation. Seek to understand their values, their needs, their abilities, their motivation, and potential barriers to changing behaviors. Listen with empathy. Seek to understand their values, their needs, abilities, motivation, and potential barriers to changing behaviors. And the E stand for empower them. Work with them to set achievable goals and identify techniques to overcome barriers. Motivational interviewing method. You can ask ask many questions as you are diving into helping someone. First thing that is not common in Africa is to ask somebody if they need our help. We actually want to impose our help. And that in North America, it's not like that. In North America, it's different. You have to ask, even if I'm going into a crisis situation where somebody maybe has taken an overdose or whatever the case, if they are conscious, I will ask them if they want me to help. If they are not conscious, then I'll do an intervention to that situation. So seek for permission. May we talk about use open and close-ended question. What do you know about, or how much do you smoke? Or all those questions are very important in order for change to come. The only time that you are permitted to tell, to inform, it is when you are an expert in the topic. For instance, if it is a father-son, conversation, and depending on how old is the son, then you are permitted to tell. But, we've realized, like in motivational interviewing, when you tell and you are not an expert in the topic, you close those lines of communication and you don't want them to be closed. So you inform. For instance, if I'm an expert, I would say diabetes causes blindness, and then give feedback to say this is what the test is showing, and advise, okay, exercise will benefit you. Or for instance, I can talk to somebody about losing weight and tell them that obesity has health complications. If I'm speaking from a perspective of a health professional that I am, and advise them and show them, okay, this is your body mass index. This is body mass. You're supposed to have this body mass. And because of the physical and the social isolation, many people have gained weight. People are looking at losing weight and they don't even know where to start or how to move forward. So you can just advise them on things that will be beneficial. And another thing is to affirm people. When you listen to people, appreciate the steps that they take to actually, some people want to get out of the situation and they are taking steps. So appreciate those steps that they are taking, reflect on what they are saying, and summarize on what they are saying. This is one of the things that is close to my heart. Mental health is close to my heart. So I always tell people, don't use slang terms. Things like cracked up, psycho, crazy, loony, nuts, waco, or stressed out. The slang term reinforces negative attitude about mental health issues. These terms must never be used because they create stigma and isolation. And then in conclusion, you might not have answers to everything, but you need to flow with the wind. There's a prayer that we ask people to pray. We call it a serenity prayer. Things that you can change them. Things that you can't change, you can't change them. You might not have answers to all your challenges, but it is profitable to long for tranquility and a peace of mind, to feel free and to leave desperation and despair behind. Keep the conversation going. And then this is the last question, obviously. I know where to access help. There are different forms of help. At this stage, there's a portal called virtual counseling, that Mental Health Commission of Canada uses. You can click on that and get your help, or you can call them. Those are the details for people who are living in Toronto area. In any place, there is help available. There is also spiritual help available. And my favorite one is Psalm 3 verse 3, which says, "But you, O Lord, are a shield for me, my glory, and the one who lifts up my head." But you are welcome to go through all those scriptures. And then the next set is those other scriptures. And my favorite in this page is the one who says, and in Psalm 34 verse 17, the Bible make us to understand that the righteous call to the Lord and he listens. He rescues them from all their troubles. All their troubles means all their troubles, all of them, including physical and social lockdown. Thank you so much for your attention, and I'll take your questions. But I want to show you the slides after this. These are the references that I've used, and these are my contact information. You are welcome to contact me at any time. I won't promise that I will answer the phone, but I promise you that if you reach out to me on email, I will be able to, reach out to you and answer you. I've been speaking a lot, so I'm twisting on my words and all that. Yeah, but I can be able to contact you back. These are references for everybody. These are websites that you can actually go to get all those references, to get all those tools that you might need. And then I just thought about future topics, and I just said, because of time, I've already used 30 minutes now. We couldn't talk about this physical and social isolation in people with pre-existing conditions, people with substance-related disorders. I'm busy in therapy, and I'm not a therapist, but this person is close to my heart, and I'm busy talking to him about substance related disorders, and I discovered that it is potentiated by the physical and social isolation. And then there are mood related disorders. Number 3 is anxiety and trauma related disorders, and number 4 is psychotic disorders. These things are different. Like when this physical and social isolation finds you in this position, it potentiates, it makes, in Canada, I have heard that the rate of suicide actually went out, and people talk about substance related disorders casually, like people have a choice, and whenever we get into this subject, we'll be able to break it down. I just thought I'll put some of the statements that are commonly used to describe mental health, because it's not all disorders. There is disorders, there's illness, there's just poor mental health, there are psychiatric illnesses, there are nervous breakdown or burned out, so that you would be able to understand what I'm saying when I say future topics. I thank you very much, and I will take your questions. Thank you for listening to us. Thank you for all the organizers of Unshakable. I want to appreciate Pastor Tony and Pastor Pat. They have been wonderful. They've been great. And all the people who anchored this program, Dr. Emmanuel, Sister Bibi, I really appreciate you. And I want to appreciate Dr. Judith, Dr. Pastor Vincent, and Michelle, for being part of the panel and bringing an insight from your world, insight from the pastor's perspective, insight from Dr. Judith. It's an all-rounder, and I love the fact that she spoke a lot about her experiences in Canada. And my prayer is that we will have more time to be able to interrogate this topic, at least maybe 25 minutes to present, and maybe 5 minutes to to wrap up and map up the way forward. But I really do appreciate this time, and thank you very much to everybody who tuned in. Thank you very much, Dr. Spakula. You know, my two sons who are in Ukraine, who the one is already a doctor, the one is becoming a doctor next year. Thank you for tuning in. Thank you for tossing. She's also completing her medical degree next year. Thank you very much. They also have a program in Ukraine that, you know, deals with mental health, and maybe one day I will invite the same panel to actually do what we did today. Thank you very much to the technical department. I'm so grateful. And if I didn't mention you by name, Chichi, Deaconess Yudi, Ife, and I hope I didn't leave anybody. Thank you, thank you, thank you, thank you so much. Thank you so much to the visionaries of this program. I really appreciate the time. And thank you very much to my husband, Isaiah Onibai. I call him my pastor. He is my motivator. He leads me, he anchors me, he creates me. He let me become, you know, what I have become today. Thank you so much. God bless you.